The nurse is monitoring a postpartum client in the 4th stage of labor. Which finding, if noted by the nurse, indicates a complication related to a laceration of the birth canal? 1. Presence of dark red lochia. 2. Palpation of the uterus as a firm, contracted ball. 3. The saturation of more than 1 parapad per hour. 4. Palpation of the fundus at the level of the umbilicus. Answer. 3. The saturation of more than 1 parapad per hour. Rationale. Saturation of more than 1 parapad per hour is considered excessive even in the early postpartum period. In the first 24 hours after birth, the uterus will feel like a firmly contracted ball, roughly the size of a large grapefruit. One easily can locate the uterus at the level of the umbilicus. Lochia should be dark red and moderate in amount. The nurse is preparing to assess the uterine fundus of a client in the immediate postpartum period. After locating the fundus, the nurse notes that the uterus feels soft and boggy. Which nursing intervention is appropriate? 1. Elevate the client's legs. 2. Massage the fundus until it is firm. 3. Ask the client to turn on her left side. 4. Push on the uterus to assist in expressing clots. Answer. 2. Massage the fundus until it is firm. Rationale. If the uterus is not contracted firmly, the initial intervention is to massage the fundus until it is firm and to express clots that may have accumulated in the uterus. Elevating the client's legs and positioning the client on the side would not assist in managing uterine atony. Pushing on an uncontracted uterus can invert the uterus and cause massive hemorrhage. The nurse is monitoring a client in the immediate postpartum period for signs of hemorrhage. Which sign, if noted, would be an early sign of excessive blood loss? 1. A temperature of 100.4 F, 38 C. 2. An increase in the pulse rate from 88 to 102 beats per minute. 3. A blood pressure change from 130/88 to 124/80 of a millimeter Hg. 4. An increase in the respiratory rate from 18 to 22 breaths per minute. Answer. 2. An increase in the pulse rate from 88 to 102 beats per minute. Rationale. During the 4th stage of labor, the maternal blood pressure, pulse, and respiration should be checked every 15 minutes during the first hour. An increasing pulse is an early sign of excessive blood loss because the heart pumps faster to compensate for reduced blood volume. A slight increase in temperature is normal. The blood pressure decreases as the blood volume diminishes, but a decreased blood pressure would not be the earliest sign of hemorrhage. The respiratory rate is slightly increased from normal. A pregnant woman seen in the healthcare clinic has tested positive for human immunodeficiency virus, HIV. What can the nurse determine based on this information? 1. The woman has the herpes simplex virus, HSV. 2. The woman has contracted an airborne viral disease. 3. The neonate will definitely develop this disease after birth. 4. HIV antibodies are detected by the enzyme-linked immunosorbent assay, ELISA, test. Answer. 4. HIV antibodies are detected by the enzyme-linked immunosorbent assay, ELISA, test. Rationale. Diagnosis of HIV infection depends on serological studies to detect HIV antibodies. The most commonly used test is the ELISA. HIV and herpes simplex virus are different types of infections. HIV infection occurs primarily through the exchange of body fluids, not via airborne disease. A neonate born to an HIV-positive mother is at risk for developing the virus, but it is not an absolute. A client arrives at the healthcare clinic and tells the nurse that her last menstrual period was 9 weeks ago. The client tells the nurse that a home pregnancy test was positive but that she began to have mild cramps and is now having moderate vaginal bleeding. On physical examination of the client, it is noted that she has a dilated cervix, which statement, if made by the client, indicates that the client is interpreting the situation correctly. 1. I will need to remain on bed rest for 2 weeks. 2. I will need to take a full course of antibiotic treatment. 3. I will need to take tocolytic medication to halt the labor process. 4. I will need to prepare myself and my family for the loss of this pregnancy. Answer. 4. I will need to prepare myself and my family for the loss of this pregnancy. Rationale. The client is experiencing a spontaneous abortion, miscarriage, which cannot be prevented and will terminate her pregnancy. Bed rest will not reverse this process. The nurse is caring for a client during the second stage of labor. On assessment, the nurse notes a loss of variability. What is the initial nursing action? 1. Turn the client on her side and administer oxygen by face mask at 8 to 10 L per minute. 2. Turn the client on her back and administer oxygen by face mask at 8 to 10 L per minute. 3. Turn the client on her side and administer oxygen by nasal cannula at 2 to 4 L per minute. 4. Turn the client on her back and administer oxygen by nasal cannula at 2 to 4 L per minute. Answer. 1. Turn the client on her side and administer oxygen by face mask at 8 to 10 L per minute. Rationale. If a fetal heart rate begins to slow or a loss of variability is observed, this could indicate fetal distress. To facilitate oxygen to the mother and her fetus, the client is turned to her side, which reduces the pressure of the uterus on the ascending vena cava and descending aorta. Oxygen at 8 to 10 L per minute is applied to the mother by face mask. The home care nurse is visiting a prenatal client who has a history of heart disease. The nurse provides instructions to the client regarding home care measures to promote a healthy pregnancy and includes which measure in that instruction? 1. Increase daily calories to ensure weight gain. 2. Maintain a supine position during rest periods. 3. Restrict visitors who may have an active infection. 4. Avoid becoming concerned about placing stress on the heart. Answer. 3. Restrict visitors who may have an active infection. Rationale. The client should avoid exposure to infection and not allow persons with active infections to visit. Too much weight gain causes an increase in body requirements and increases stress on the heart. The client should rest on the left side to promote blood return. Stress causes increased heart workload, with the potential for adverse consequences. A home care nurse is visiting a pregnant client with a diagnosis of mild preeclampsia. What is the priority nursing intervention during the home visit? 1. Monitor for fetal movement. 2. Monitor the maternal blood glucose. 3. Instruct the client to maintain complete bed rest. 4. Instruct the client to restrict dietary sodium and any food items that contain sodium. Answer. 1. Monitor for fetal movement. Rationale. A client with mild preeclampsia can be managed at home. The priority intervention of the home care nurse is to monitor for fetal movement. The expectant mother also is asked to keep a record of fetal movements. A maternal blood glucose would not provide specific data related to preeclampsia. Bed rest with bathroom privileges is prescribed. Complete bed rest is not necessary. Urine should be checked for protein. Sodium restriction is not necessary. The nurse implements a teaching plan for a pregnant client who is newly diagnosed with gestational diabetes mellitus. Which statement made by the client indicates a need for further teaching? 1. I should stay on the diabetic diet. 2. I should perform glucose monitoring at home. 3. I should avoid exercise because of the negative effects on insulin production. 4. I should be aware of any infections and report signs of infection immediately to my obstetrician. Answer. 3. I should avoid exercise because of the negative effects on insulin production. Rationale. Exercise is safe for a client with gestational diabetes mellitus and is helpful in lowering the blood glucose level. Dietary modifications are the mainstay of treatment, and the client is placed on a standard diabetic diet. Many clients are taught to perform blood glucose monitoring. If the client is not performing the blood glucose monitoring at home, it is performed at the clinic or obstetrician's office. Signs of infection need to be reported to the obstetrician. The nurse is caring for a client in labor who is receiving oxytocin by intravenous infusion to stimulate uterine contractions. Which assessment findings should indicate to the nurse that the infusion needs to be discontinued? 1. Increased urinary output. 2. A fetal heart rate of 90 beats per minute. 3. 3 contractions occurring within a 10-minute period. 4. Adequate resting tone of the uterus palpated between contractions. Answer. 2. A fetal heart rate of 90 beats per minute. Rationale. A normal fetal heart rate is 110 to 160 beats per minute. Bradycardia or late or variable decelerations indicate fetal distress and the need to discontinue the oxytocin. Increased urinary output is unrelated to the use of oxytocin. The goal of labor augmentation is to achieve 3 good quality contractions, appropriate intensity and duration, in a 10-minute period. The uterus should return to resting tone between contractions, and there should be no evidence of fetal distress. On the second postpartum day, a client complains of burning on urination, urgency, and frequency of urination. A urinalysis indicates the presence of a urinary tract infection. The nurse instructs the client regarding measures to take for the treatment of the infection. Which client statement indicates to the nurse the need for further instruction? 1. I need to urinate frequently throughout the day. 2. The prescribed medication must be taken until it is finished. 3. My fluid intake should be increased to at least 3,000 milliliters daily. 4. Foods and fluids that will increase urine alkalinity should be consumed. Answer. 4. Foods and fluids that will increase urine alkalinity should be consumed. Rationale. A client with a urinary tract infection must be encouraged to take the prescribed medication for the entire time it is prescribed. The client should also be instructed to drink at least 3,000 milliliters of fluid each day to flush the infection from the bladder and to urinate frequently throughout the day. Foods and fluids that acidify the urine need to be encouraged. The home care nurse is monitoring a pregnant client who is at risk for preeclampsia. At each home care visit, the nurse assesses the client for which sign of preeclampsia. 1. Hypertension. 2. Low-grade fever. 3. Generalized edema. 4. Increased pulse rate. Answer. 1. Hypertension. Rationale. A sign of preeclampsia is persistent hypertension. A low-grade fever or increased pulse rate is not associated with preeclampsia. Generalized edema may occur but is not a specific sign of preeclampsia because it can occur in many conditions. The nurse is preparing a plan of care for a client who just delivered a dead fetus. Which initial action should the nurse include in the client's plan of care to meet the emotional needs of the client and spouse? 1. Allow family members to name the infant. 2. Encourage the client to talk about the dead fetus. 3. Allow the client and the spouse to hold the infant. 4. Assess the client's and the spouse's perception of the event. Answer. 4. Assess the client's and the spouse's perception of the event. Rationale. The initial intervention in planning to meet the emotional needs of the client and her spouse is to assess their perception of the event. Although the actions in the remaining options are likely to be components of the plan of care, the initial intervention in planning is to assess the perception of the event. A client in preterm labor is being started on intravenous magnesium sulfate to stop the contractions. Several hours later, when the nurse is performing an assessment, the following data are obtained. Blood pressure, 110/66 of a millimeter Hg. Pulse, 66 beats per minute. Respirations, 10 breaths per minute, and deep tendon reflexes absent. What should the nurse do next? 1. Institute seizure precautions. 2. Prepare for a precipitous delivery. 3. Prepare to administer calcium gluconate as an antidote for magnesium toxicity. 4. Increase the rate of magnesium sulfate, as the desired outcome has not yet been achieved. Answer. 3. Prepare to administer calcium gluconate as an antidote for magnesium toxicity. Rationale. The antidote for magnesium sulfate is calcium gluconate. This medication should be available if the client experiences magnesium toxicity. The respiratory rate and absence of deep tendon reflexes indicate magnesium toxicity and not the need for an increase in the rate of the medication. The client is not exhibiting signs and symptoms of preeclampsia, which might necessitate seizure precautions. There are no data to indicate that this client is experiencing a precipitous labor. The nurse is caring for 4 one-day postpartum clients. Which client assessment requires the need for follow-up? 1. The client with mild afterpains. 2. The client with a pulse rate of 60 beats per minute. 3. The client with colostrum discharge from both breasts. 4. The client with lochia that is red and has a foul-smelling odor. Answer. 4. The client with lochia that is red and has a foul-smelling odor. Rationale. Lochia, the discharge present after birth, is red for the first 1 to 3 days and gradually decreases in amount. Normal lochia has a fleshy odor or an odor similar to menstrual flow. Foul-smelling or purulent lochia usually indicates infection, and these findings are not normal. The other options are normal findings for a one-day postpartum client. The nurse in a maternity unit is providing emotional support to a client and her significant other who are preparing to be discharged from the hospital after the birth of a dead fetus. Which statement made by the client indicates a component of the normal grieving process? 1. We want to attend a support group. 2. We never want to try to have a baby again. 3. We are going to try to adopt a child immediately. 4. We are okay, and we are going to try to have another baby immediately. Answer. 1. We want to attend a support group. Rationale. A support group can help the parents to work through their pain by non-judgmental sharing of feelings. The correct option identifies a statement that indicates positive, normal grieving. Although the other options may indicate reactions of the client and significant other, they are not specifically a part of the normal grieving process. The membranes of a client who is at 39 weeks gestation have ruptured spontaneously. Examination in the emergency department reveals that her cervix is dilated 4 centimeters and 75% effaced, and the fetal heart rate is 136 beats per minute. She and her partner are admitted to the birthing unit. What is the nurse's primary intervention upon the client's arrival to the unit? 1. Settle the client in bed and attach an external fetal monitor. 2. Have the client undress while taking her history from her partner. 3. Introduce the staff nurses to the couple and try to make them feel welcome. 4. Ask the couple to wait in the examining room while notifying the healthcare provider. Answer. 3. Introduce the staff nurses to the couple and try to make them feel welcome. Rationale. The client is in the first stage of labor. She and the fetus were assessed earlier, and both are stable. At this time, the priority of care is the establishment of a trusting relationship with the client and her partner. This will help allay their anxiety. Putting the client in bed and attaching an external fetal monitor may be necessary later. However, it is not the priority. The history should be taken from the client as long as she is capable of providing it. Asking the couple to wait in the examining room while notifying the healthcare provider is not a priority. The provider may have been notified already. A pregnant woman tells the nurse in the prenatal clinic that she knows that folic acid is very important during pregnancy and that she is taking a prescribed supplement. She asks the nurse which foods contain folic acid, folate, so she may add them to her diet in its natural form. Which foods should the nurse recommend? Select all that apply. 1. Beef and fish. 2. Milk and cheese. 3. Chicken and turkey. 4. Black and pinto beans. 5. Enriched bread and pasta. Answer. 4. Black and pinto beans. 5. Enriched bread and pasta. Rationale. Legumes contain large amounts of folate, as do enriched grain products. Beef and fish do not contain adequate amounts of folate. Milk and cheese do not contain adequate amounts of folate, nor does fowl.